Now, coming on to our first section, that is the burns. We'll be going through in this section through the thermal burns and the chemical burns. So, how does the thermal burns actually happen? It's basically these thermal burns are due to maybe associated with other injuries as well. For example, patient may be coming to you, or a casualty may be coming to you due to there was a fire in the building, and he had sustained burns as well and some other things as well, and to save his or her life, he or she has to jump out of the building as well. Now there will be definitely associated long bone fractures as well. There may be inhalational injury due to burns along with the thermal burns as well. So what happens in thermal burns is there is actually significant fluid shifts due to denuding of the skin, which may lead to hypovolemic shock, which may be a very profound type of hypovolemic shock at times. Due to damage by the burns, there is usually tissue swelling and airway obstruction, especially associated with inhalational burns, because once the larynx, the pharynx, and the upper airways get inflamed, there may be edema, and this may result in obstruction of the airway. This is usually associated with denaturation of cellular proteins, which may be with the burns, which may cause coagulative necrosis. And then maybe as there is relative hypovolemia, the fluid part is decreased and red blood cells increase. So there is a relative increase in hematocrit associated with increased blood viscosity. But this is maybe associated with profound hypovolemia and shock. Now coming to chemical burns. This could be due to exposure to strong alkalis or acids. For example, if an acid is thrown on somebody's face or some kind of a chemical is thrown on somebody's face as well, this can lead to specific type of burns, may be called as chemical burns. Usually it could be due to phosphorus, it could be due to phenol or petroleum products, but most commonly it is due to acids, which is important. Now, which is more worse? Is it alkali or is it acid? It is alkali. The reason, because it's more serious and deeper. And why? Because alkali burns cause liquefactive necrosis. That is, they penetrate more deep and into the tissues and lead to increased amount of necrosis, which has higher depth. As compared to acids, usually they cause coagulative necrosis. And this coagulative necrosis is in a kind of helpful, because coagulation occurs and there is an eschar formation, which is actually a form of protective tissue which is formed and protects the more deeper layer. So if obviously both are bad, but if we are considering it which is more serious, alkali burns are more serious than the acid burns, because alkalis cause liquefactive necrosis and acid cause coagulative necrosis. Now, how to analyze them, how to recognize these problems? Usually the definite diagnosis depends upon the history. The patient would tell you that something was thrown on me. Could be some kind of a chemical. So what was it? Usually the chemical involved we may know what type of chemical was involved. Its concentration is important, because the higher the concentrated chemical is and the greater the time of exposure, the more damage it will cause. So alkali burns usually appear on clinical examination. They usually appear as full thickness injuries as they penetrate more deep into the tissue. They appear pale, that is, usually skin is pale, leathery, and usually slippery or soapy surface is seen on the skin. While acid with burns, usually they are often partial thickness injuries, where they are accompanied by erythema and erosion. Although they look bad on naked eye to the examination, but the good part is usually this eschar formation at the top, which actually helps in protection of the deeper tissue. So in a way, its skin looks leathery and less damaging, but actually the alkali is penetrated very deep into the tissues. Now, how to look at the different acid burns. If the skin is black, then probably this is due to hydrochloric acid or HCl. If it's yellow, then it's going to be due to the use of nitric acid. Or if it's brown, this eschar which is on the top is brown, then most likely the acid which was used was sulfuric acid. Now, once we recognize it through the history and examination, then we have to start with the management. In case of all the trauma, the management always starts with the A, B, C, that is airway and cervical spine. If the acid or alkali was thrown on the face, you have to make it sure that airway is patent. You ask the patient's name, and if he or she is able to tell you that his or her name, then probably the airway is patent. But airway can be blocked. There could be loss of airway due to edema and eventually other problems as well. So we have to be on the lookout whether the airway compromise has occurred or not. So management starts with airway, then the airway and cervical spine, then breathing, circulation, and disability. Once we are done with the primary survey, then we move on to the specifics of the acid burn management. Actually, we have to minimize the area, that is the irreversible damage, and maximize the salvage zone of reversible damage. We can give neutralizing agents as well, but the first and foremost is to get rid of the body of the all that clothes which are actually maybe patient was wearing must be removed, so that the continuous injuries has to be stopped. Copious water irrigation has to be done so that the skin is actually washed off all the irritant which is present on the skin. Calcium gluconate can be used for hydrofluoric acid burns, but if we know by definition that on history we are sure that patient was been thrown with hydrofluoric acid. Polyethylene glycol can be used for phenol burns, and sometimes if the eschar is there, it is causing necrosis of the skin, we may have to go for surgical excision of all that and all the deprive all the necrotic tissue. In this section, we have briefly gone through what are the treatment of chemical and thermal burns. Thermal burns are important because patient may be having a polytrauma associated with inhalation injury, and which could be very damaging but may cause eventually the airway compromise. As far as chemical burns are concerned, we have to be sure by history whether it's an acid or an alkali burns. Acids are less dangerous, alkalis are more dangerous because they cause liquefactive necrosis and penetrate more deep into the tissues. Management of all these chemical burn is simply that we start with the trauma ATLS protocol, that the airway and cervical spine must be secured before we start with the management. Copious irrigations of this and supportive treatment is the actually mainstay of the treatment in case of acid burns. Sometimes surgery may be required depending upon how much debridement is needed. Thank you very much. Keep watching sqadia.com.